And thank you for joining us here on the News at 10. You know, you can count on them like you can count on 90-degree days in a southern Idaho summer. If you spend any amount of time in the outdoors, especially in any amount of backcountry brush, chances are you've brushed up against some ticks. Those bothersome bloodsuckers can cause some serious health problems too. So it's important to know what to do if you have a tick. News Channel 7's Jude Binkley had a tick talk with a doctor about the uptick that we're seeing in ticks.
Brian, we're in the middle of peak tick season, which runs from around May to July. And doctors say that tick seasons are especially bad during years like this, when there's been a lot of rain and brush growth. The sun is out, and so are the ticks.
These foothills are very active with ticks in the springtime and early summer.
The parasites hide in tall grasses and shrubs, waiting for a host. Dr. Kirk Campagna at AFC Urgent Care says ticks live on blood, kind of like mosquitoes.
They go from host to host, and so there are blood-borne illnesses, viruses, parasites, bacteria.
Illnesses like Lyme disease, although Dr. Campagna says Lyme disease is more common on the East Coast. Ticks can also spread diseases like Rocky Mountain spotted fever, which can lead to permanent health complications.
Contracting the disease is, first of all, very sensitive to how long the tick was attached, and two, the ability to treat the illness is very sensitive to how long you've had it.
Before you head into the backcountry this summer, there are some ways to help prevent getting ticks.
One of the best protections is a barrier.
Barriers like longer layers or insect repellent like DEET, and when you get back home,
a lot of people have a habit or a good routine of showering afterwards and just kind of doing a survey.
If you do find a tick,
a lot of times you can just flick it off.
Unless it's already attached.
And you can tell when it's attached because the head's down buried into the skin and the abdomen or round part is sticking up in the air.
Dr. Campagna says the best way to remove a tick is with a pair of pointed tweezers or forceps.
You get as close to your skin as possible and grab its mouth parts and just lift straight up, and then wash with soap and water to kind of get rid of any infectious agents that might be present.
After you remove a tick, watch for redness or a sore in that area.
It's really key that you get checked out early if you think you have something unusual going on.
Now, Dr. Campagna also says that whenever you handle or remove a tick, make sure to wash your hands right after, because that tick might have blood or pathogens from other animals or humans.
Pulled a few off of my own dogs myself, actually, over the years. So yeah, it's tricky, and you got to really watch for them, especially on the dogs, because they get in that hair and they can really be hidden for a long, long time. All right, thank you very much, Jude.